In this video, we are going to discuss about a few reasons that why community medicine is important among all other subjects and why an MBBS student must learn community medicine thoroughly. These are all few reasons that I have prioritized. The eighth reason which I point out will be the history of medicine. History of medicine is beautifully dealt in community medicine when compared to any other subject. Starting from ancient ages to till date, it has discussed such beautifully. The seventh point is preventive medicine. Community medicine was previously called as social and preventive medicine. Preventive medicine is not a measurable medicine, but a pleasurable medicine. Here you have to note a point that when a clinician treats 50 cases of dengue, it is easily measurable. But an epidemiologist, when he prevents 5 lakh cases of dengue, it is not measurable, but again, it is pleasurable. Then the sixth point here is concept of health. Clinicians always treat individual patients. Epidemiologists treat with populations. Clinicians always mention I. Epidemiologists say we. So clinicians are stuck with illness, whereas epidemiologists go one step beyond and treat wellness. You have to remember the wellness, that is the health, and the illness and the disease are not separated by a very narrow line. But by here, you have to understand the fact that you have to promote health, maintain health, and treat the disease, preventive medicine, cure the disease. So all has been comprehensively dealt only in community medicine. Then coming to the fifth point, that is the chapter of environment. The dirty tag for the community medicine has been derived from this chapter. That is, this chapter deals with all dirty things like garbage, toilet, mosquitoes and all. But if you read these chapters, there is such a beautiful science which is hidden behind these concepts. Now, my fourth point is the sociology, which is the most neglected among all the chapters of community medicine. We never try to read this sociology, that is the study of human behavior and how to emotionally bond with the patient. So that concept is the most neglected, and when that is focused, all this doctor-person relationship will be very beautiful in future. Then the third point I am giving here is the research. Whenever you hear this word research or any terms related to research such as statistics, study design, or anything related to research, you will remember community medicine. At least when you join PG course, during that time, when MD thesis is made mandatory, you are compelled to do that thesis. Definitely at that point of time, you would have regretted, I would have learned a better research in my UG days in community medicine. So that is my third point. Moving on to the second point, the concept of primary health care is taught only in community medicine. Under what are all programs from the government of India and Tamil Nadu or any other state, how the diseases are targeted, all these things are dealt only in community medicine. And moreover, the primary health centers where about 30% of MBBS outgoing students will be employed there. Students are exposed to those settings only by community medicine. See, if you are not convinced with the reason which I have told you right now, for entrance exams, you will get maximum number of questions from community medicine after general medicine. And many times, pediatrics, obstetrics, general medicine, the questions will be from community medicine based. So this is the second most important prioritized subject in your entrance. Out of these questions, 80 to 90% of the questions you can answer directly from PARC, which no other textbook can do for your entrance preparation. Now, with these reasons, I am ending my